Ladies, let's talk about something we don't discuss enough: birth control after 40. If you're in this age group, still on the pill, and wondering why you feel more anxious, tired, moody, or just off, you're not crazy and you're not alone. Our bodies go through so many changes in our 40s, and what we often don't realize is that birth control plays a role too. Birth control after 40 can help, but it can also hide what's really happening inside your body. It can mask the natural hormonal shifts of perimenopause and even menopause. Many women in their 40s assume their symptoms are just stress or getting older, but it's important to understand how your birth control might be contributing. Over the next few minutes, we're going to break down the most common types of birth control used by women over 40, talk about their benefits, and discuss the potential risks and side effects. Knowledge is power, and understanding your options is the first step to feeling your best. Let's start with the most familiar type of birth control, the pill. Combined oral contraceptives, or COCs, contain both estrogen and progestin. They've been around for decades and are effective and convenient. COCs regulate your cycle, making periods lighter and more predictable. They can also relieve PMS symptoms like bloating and mood swings. However, for women over 40, there are risks, like increased blood clots. This is especially true for smokers or those with high blood pressure. COCs can also mask perimenopause symptoms, delaying diagnosis. Discuss your risks and concerns with your healthcare provider to determine if the pill is right for you. Now, let's talk about progestin-only pills, also known as the mini pill. Unlike combined oral contraceptives, these pills only contain progestin, a synthetic form of the hormone progesterone. This can be a good option for women who can't tolerate estrogen or have certain health conditions that make estrogen-containing contraceptives risky. One of the main advantages of progestin-only pills is their lower risk of blood clots compared to COCs. This makes them a safer choice for women over 40, especially those with additional risk factors. Additionally, progestin-only pills don't typically affect libido the way COCs can, which is a relief for many women. However, progestin-only pills do come with their own set of potential drawbacks. The most common side effect is irregular bleeding. Some women experience spotting or breakthrough bleeding between periods, while others may have lighter periods or even stop having periods altogether. While this irregularity can be annoying, it's usually harmless and tends to improve after the first few months of use. However, it's essential to be aware of this side effect, as it can sometimes make it difficult to track your cycle or detect pregnancy. Another potential downside of progestin-only pills is their impact on mood. Progestin can affect the balance of neurotransmitters in the brain, which can lead to mood swings, irritability, and even depression in some women. If you have a history of mood disorders, it's crucial to discuss this with your doctor before starting progestin-only pills. It's important to remember that everyone responds to hormones differently. What works well for one woman might not work for another. If you're considering progestin-only pills, talk to your healthcare provider about your medical history, any medications you're taking, and your individual needs and preferences. Let's move on to another popular long-acting reversible contraceptive option, hormonal IUDs. These small T-shaped devices are inserted into the uterus and release a low, steady dose of progestin directly into the uterine lining. There are several types of hormonal IUDs available, including Mirena, Kalina, and Skyla, each with slightly different hormone doses and durations of use. One of the significant advantages of hormonal IUDs is their effectiveness. They're over 99% effective at preventing pregnancy, making them one of the most reliable forms of contraception available. Another benefit of hormonal IUDs is their convenience. Once inserted, they can last for several years depending on the type. This means you don't have to remember to take a pill every day or worry about replacing a patch or ring regularly. This set-it-and-forget-it aspect is appealing to many women, especially those with busy lifestyles. Hormonal IUDs also offer the advantage of localized hormone delivery. Unlike pills or patches that release hormones into your bloodstream, IUDs primarily affect the uterus. This means the overall hormone exposure is lower, potentially reducing the risk of systemic side effects. However, it's important to be aware that hormonal IUDs can still cause side effects, even though the hormone exposure is localized. The most common side effect is irregular bleeding, especially during the first few months after insertion. Some women experience spotting, breakthrough bleeding, or prolonged periods, while others may have lighter periods or stop having periods altogether. Other potential side effects of hormonal IUDs include mood changes, headaches, acne, breast tenderness, and ovarian cysts. While these side effects are typically mild and tend to improve over time, it's essential to be aware of them and discuss any concerns with your doctor. It's also worth noting that hormonal IUDs don't protect against sexually transmitted infections. If you're not in a monogamous relationship or are unsure of your partner's STI status, it's crucial to use barrier methods like condoms in addition to your IUD. Now let's talk about another long-acting reversible contraceptive option, the implant. The implant is a small, flexible rod about the size of a matchstick that's inserted under the skin of your upper arm. It releases a continuous, low dose of progestin into your bloodstream, providing highly effective contraception for up to 3 years. One of the most significant advantages of the implant is its convenience. Once it's inserted, you don't have to think about birth control for years. This can be incredibly freeing, especially for women who find it challenging to remember to take a pill every day or who have difficulty with other methods. Another benefit of the implant is its effectiveness. It's over 99% effective at preventing pregnancy, making it one of the most reliable forms of contraception available. The implant works by preventing ovulation, thickening cervical mucus, and thinning the uterine lining, making it difficult for sperm to reach an egg and for a fertilized egg to implant. Like other progestin-only methods, the implant doesn't contain estrogen, which can be a significant advantage for women who can't tolerate estrogen or have certain health conditions that make estrogen-containing contraceptives risky. However, it's essential to be aware that the implant, like all hormonal contraceptives, can cause side effects. The most common side effect is irregular bleeding. Some women experience spotting or breakthrough bleeding between periods, while others may have lighter periods or even stop having periods altogether. Other potential side effects of the implant include headaches, weight gain, mood changes, breast tenderness, and acne. While these side effects are typically mild and tend to improve over time, it's essential to be aware of them and discuss any concerns with your doctor. Finally, let's talk about 2 other hormonal contraceptive options, the patch and the ring. These methods offer a balance of convenience and effectiveness, making them popular choices for many women. The patch is a thin, beige sticker that you apply to your skin once a week for 3 weeks, followed by a patch-free week. It releases both estrogen and progestin into your bloodstream, preventing pregnancy in a similar way to combined oral contraceptives. The ring is a small, flexible ring that you insert into your vagina once a month. It releases a low, steady dose of estrogen and progestin, providing continuous contraception for 3 weeks. After 3 weeks, you remove the ring for a week to allow for a withdrawal bleed, similar to a period. Both the patch and the ring are highly effective at preventing pregnancy when used correctly. They're also discreet and convenient, as you don't have to remember to take a pill every day. However, it's essential to be aware of the potential side effects associated with these methods. Because the patch and the ring contain estrogen, they carry a slightly increased risk of blood clots compared to progestin-only methods. This risk is still relatively low, but it's essential to discuss your individual risk factors with your doctor. Other potential side effects of the patch and the ring include breast tenderness, headaches, nausea, mood swings, and skin irritation at the application site for the patch. These side effects are typically mild and tend to improve over time. It's essential to choose a birth control method that aligns with your lifestyle, preferences, and health history. If you're considering the patch or the ring, talk to your healthcare provider about your individual needs and any concerns you have. Birth control after 40 can offer relief, but it can also create confusion. If you feel like your body's sending mixed signals, you're not alone. We help women decode their hormones every single day. Inside Leap 2. Better Health, we show you how to navigate midlife hormones with clarity. Whether you stay on the pill, come off, or go holistic, it's not about one right way, it's about your way. We provide evidence-based information, personalized guidance, and a supportive community to empower you to make informed decisions about your body and your health. Join the movement of women reclaiming their health over 40. Visit the link in the description to learn more about Leap 2. Better health and start your journey toward hormonal well-being today.